Today I'm pleased to share a major announcement of new funding to protect folks in continuing care. These residents are at the highest risk from COVID-19, and the operators of these facilities have been doing their best to protect them. But the operators have rightly raised concerns about the costs of complying with public health orders that we've put in place. So today I'm announcing funding of more than $14 million per month, or $170 million per year. It will cover enhanced staffing as well as costs for cleaning supplies and loss of accommodation revenue due to vacant beds and rent freezes. And it's going to be maintained throughout all stages of Alberta's relaunch until the public health orders are lifted and the threat of COVID-19 is passed. More than 70% of COVID-19 deaths in this province are in our continuing care facilities.
Today, I am pleased to report 5,584 Albertans have recovered from COVID-19, leaving 1,004 active cases in the province. Currently, 61 people are hospitalized with COVID-19, with 8 of those admitted to ICUs. In the last 24 hours, out of 2,428 new test results, there were 33 new cases. I'm pleased to report there are no new deaths today. While it is too early to see the full impact of relaunch, so far our case numbers in the province have held steady. We are not seeing any increase so far in numbers in Calgary and Brooks, and overall, as I mentioned, our cases are stable. Singing is an activity that has a higher risk of spreading the virus than simply talking to someone. And so the restrictions that are on religious gatherings with respect to no group singing would apply to choirs as well. And certainly that's something we've been getting questions about then for things like concert bands with brass instruments or wind instruments, whether or not that poses a risk. And we're looking at those questions. I don't have an answer for bands or those who are playing instruments in a group together today. We need to remember that being safe while relaunching the economy can save lives. The virus is still with us, and we must do everything we can to prevent the spread at home, when we are out, and when we are at work.